Welcome to Your Family Dog, a podcast dedicated to helping families love living with dogs. Here are your hosts, Julie Fudge Smith and Colleen Pelar.
Hi, and welcome to Your Family Dog. I'm Julie Fudge Smith, and I'm here with Colleen Pelar, and today we have a special guest, Dr. Laurie Schultze. She is a veterinarian who graduated in 1997 from the Ohio State University Veterinary School. She started out in she did an equine internship and then did a mixed practice for 1 year, at which point she switched to small animals. And that's where she started to really pique her interest in behavior. And she started to concentrate on behavior. Although when she was in school, she did take the one and only behavior class that was offered. So good for you. Now she worked as a relief vet for a while, and now she does exclusively behavior. And interestingly, she does it in home. So one of the things we wanted to talk to Laurie about is what's it like to be an in-home vet. But Colleen, I think you had a question to start with that didn't have to do with that. Is that right?
Yeah. My question doesn't have anything to do with dogs, which is our usual subject, but it's horses. So you started out in horses, which I think is really interesting. What made you switch from horses to dogs?
Well, I always thought I wanted to do a mixed practice. So then I had an opportunity to do an equine internship, which I did. And then quite honestly, it had to do with a husband getting married and where I got engaged. So therefore I had to change where we were going. So then I did a mixed practice. But to be quite honest, I discovered I didn't like going out in the cold. When I did an internship, they came to us. My plan was to go move to Texas, a warmer climate. But when my husband proposed, things changed, as they do. So moved back to Ohio because I was in Chicago, but we had the barn in the hospital, so it was warm there. Mm-hmm. So, after a year of doing mixed and going out, and then children came, those kinds of things happened. And I was still taking care of, I did mostly horses and dogs and cats. So I was still doing small animal at the mixed practice. So then after children and going out on calls, it just really, that's why I switched to small animal.
Do you exclusively dogs now, or do you do dogs and cats in home?
Dogs and cats behavior consults, yes.
Oh, good for you. Good for you. And I have one follow-up equine question, which is, I was kind of curious. Did you grow up with horses? Were you comfortable with them before vet practice, or did you discover them?
I wouldn't say I grew up with them. I was always a horse addict little girl, and my parents said they were going. My dad, I remember when I was 5, he told me he was going to get me a horse, and then he started talking to someone that had horses and realized how much they cost. So then As a horse owner, I know that. Yes. So I got lessons, which I am grateful for. I started when I was in elementary school and through junior high, but then I got involved in drill team and dance, and anyway, didn't ride horses anymore, but I've always had a love and a passion for them. And I'm riding again now. So anyway, still, and, I don't do equine behavior, but I'm very fascinated with it and, try to get educated about it, because the more I know about behavior with dogs and cats that I've learned, the more I would like things to change in the equine world. But that's a whole other different conversation.
Yeah,
it is. And I couldn't agree with you more. Having had 2 daughters who showed and seeing what happens in the show world, it's not a pretty world and for horses. And I agree with you. So, but then there's not, that I know of, a whole lot of, if any, really concentrated equine behaviorists either. I think you could probably make a killing at that one. You could probably travel the world being an equine behaviorist, but not, you got kids, you got a family, you settle down and you do what you got to do. So you started with, but you said you've always been interested in behavior. Right. So when you started, I know my other question. I have to ask it. In your mixed animal behavior, did you do goats and donkeys and cows and stuff? Because I love donkeys.
I didn't do I did do a little bit. The practice I was at, I was mostly the horse and the dog cat, but I did have to go out and do some things, bleed pigs for the fair,
bleed pigs
Yeah,
for the
that's
fair?
what they call it. Yeah, pseudo-rabies. You have to have a pseudo-rabies test for showing the pigs. You did back then. This is a long time ago. I don't even know right now currently if they do that. And then
I had visions of leeches, going out.
No. It was not. No, you drew the blood, but anyway, that was just something that I did, but I didn't really work with them very much. I did do a couple cattle calls, but mostly it was dogs, cats, and horses.
Okay. All right.
So I guess we should talk about dogs now, huh?
Yeah.
Supposedly the topic that brings us together, and yet off we'll go in any direction. Okay,
yes, I do.
So now that you do mostly behavior work and you go to people in their homes, is there a problem that is your most common, the bread and butter issue that, 5 calls out of 10 are this?
It seems, unfortunately, a lot is related to aggression. Is mostly what I get most of my calls on. And I also think it's important to note I'm a veterinarian that does behavior. I am not a boarded behaviorist, which in our area, that's Dr. Megan Herron. However, I discovered, there's quite a bit of need because they even have a couple-month waiting list sometimes to get people to come to help with the problems. And it's easy for clients to get confused on who they should call when they're having a problem.
Yeah.
And I'm unfortunately seeing a lot more where I'm the second or third person to come out where maybe they have went with a trainer that used, quite frankly, they're using shock collars. Mm-hmm. And then they get to me, which I wish they were getting to me sooner. And that's a whole other conversation. I'm not sure why that happens, but aggression is the one I get mostly. Some sort of aggression, whether it's towards the owner, reacting to another dog. Usually it's related to people.
Yeah.
And it might be a stranger or, unfamiliar person coming, or maybe it's with the owner.
Mm-hmm.
So how do people get to you, Laurie? Do they, are they referred through their vet or a trainer, or how do they get to you?
A couple different ways. So Ohio State, now that they have even with Dr. Lilly, their resident there, sometimes they still get backed up. So they will set them on to me. I have a website. It's www.protectthebond.com. People can find me online, or I have local veterinarians that know me and send me clients. There's a few positive dog trainers that send me. Obviously, they shock collar dog trainers are not sending me clients. I get them through the back
afterward
when they're at the end.
Right.
So that's how people find. So I'm a member of American Veterinary Society for Animal Behavior, AVSAB. That's another place that people can look to look for veterinarians. Now, granted, it's a group of veterinarians. You can be a boarded behaviorist and be a part of AVSAB, but it's more like a club. But we all, it's a professional organization that we all have standards, that we're only going to use positive reinforcement and current. Right. So if someone doesn't know how to find a veterinarian to help them in their area, they can look at that website and do a search, because they tend to be more behavior savvy, or you're going to have someone that can help you with that. And now with the fear-free, that's another way.
Mm-hmm. Right.
Now that there's other organizations, Dr. Sally Foote has their certification program too. Because these things, I started doing this before those came. So I might not be, I'm very supportive of those methods, but I'm talking in general, if someone's looking for a behavior practice, or a veterinarian that is aware of behavior, that's one way they can find someone in their area, especially if they don't have anyone.
Right. We really like the position statements that AVSAB has put out. We're so grateful to have, the PDF we can link to and say, it's not just us saying this. Look, these are the people who are saying this.
Yeah. So one of the advantages I would think of that you have over, say, Colleen and I, who we do, behavior consults as well, is that you have a veterinarian degree so that you can do medications, which we can't.
Yeah.
So I'm assuming that you are probably familiar with the broad range of psychopharmacology, from short-term, trigger medications to long-term, and what to do if somebody has, say, their general practitioners put their dog on Prozac, and yet we're seeing some residual symptoms. You would know how to transition the dog to another drug.
Yeah, or some things. A couple of situations I had one client, her dog was placed on a short-term medication for separation anxiety, and without going into all the details, I can just say it was a situational trazodone, but you can use that medication. Sometimes dogs can take it daily and it's helpful. Well, they thought the dog was doing well because the dog was no longer causing destruction. Okay, so they assumed dog was fine. Mm-hmm. Well, then the dog started having other issues with the aggression towards unfamiliar people, and they were expecting a baby in 7 days.
Oh dear.
Oh yeah. So anyway, long story short, without going into all of it, talking to them, I wasn't convinced, and they had recently moved. I was like, well, have we seen a video? I'd really like to see a video to make sure that your dog's anxiety is managed. Because, I'm not convinced that that's still, managed, and we may need to add a daily medication since you're seeing these other issues, that they weren't connecting that their dog had a general anxiety problem. They just thought their dog had a separation anxiety problem. Mm-hmm. But then as things were changing, their environment changed, they started to see other problems that until they were getting ready to have a baby in 7 days, they didn't see it as a problem. Mm-hmm. But when the dog started barking and reacting at a child that just ran by that didn't do anything, they were like, oh no. So, but when I was able to come to the home and talk to them about that, I was able to piece apart something that sometimes a veterinarian in a 15, 20-minute visit, when you just go, when you're just in there for your wellness, might not get the whole picture. Mm-hmm. So when I had them video the dog, which they did, we discovered, and it was good for them to see, not that it was good for us to see this, but the dog in the current dose that they were using, even though the dog wasn't destroying, the dog was pacing the whole time and barking. So therefore we knew that's not the right medication or the right dose. So then we started, I was able to manipulate the medication that we got that problem under control. And that is one benefit of having a veterinarian come to the home that's behavior savvy, or getting a veterinarian that has the time, not saying you always have to come to the home, but if things aren't progressing, that's when it's good to call in someone such as myself, or if you're in an area with Dr. Heron, or a board certified behaviorist, to get them involved. It's just here their baby was going to come. Literally, they were inducing in 7 days, and you can't get into Dr. Heron in 7 days. That's just not going to happen. So in that case, I was able to go out. You can't always get to me in 7 days, but I was able to get out there to help them with getting things under control. So that's an example of where having someone, that can prescribe medication. And I recently, even though I said aggression, this is another separation anxiety issue. A couple had just adopted a little Pekingese, and when they were leaving, they had to leave the dog alone, and it was screaming in the crate and really stressed. And took a video, and I was able to. Yes, there's going to be behavior modification a part of that, but there is no way that dog was going to be okay without some sort of medication. Just, it was panicked, and they were in a situation where they were going to have to be able to leave the dog, and they were concerned the dog was going to hurt itself, which it could have. So, that's a pathological situation, and not necessarily, you just have to train it to the crate. That's going to be a part, we're going to work on departures, but if you're so panicked or freaked out, you can't learn things. And,
correct.
Also sometimes clients, and the older I get, the more more empathetic. I think I've become too, I try to realize people are limited sometimes with what their limitations are. So I try to work with, okay, this is the ideal situation. What can we do? And realize they might not do everything exactly how I would do it if it was the ideal situation, because they may not, they'd be like, I'm going to have the dog in the crate. So then I'm like, okay, where are you at? We're going to make this dog more comfortable, and since that's what you're want to do, we have to use medication because it's a welfare issue. And which they are great owners, and they're helping out this little dog.
Do you think anxiety is more common in dogs these days, or we just didn't recognize it all those years ago?
That is a question. I wonder. I don't know. I have theories, but then maybe I'm seeing a skewed population because I'm seeing situations where they're needing help versus, I don't know if more of the dogs adopted today, how many of them have issues from rescues? I don't know. Now, this dog came from a hoarding situation, so I'm not surprised that it has problems that it has.
Well, I also wonder, too, if we have more dogs that are being adopted from things like hoarding situations and puppy mills than perhaps we did in the past. And those dogs are going to be more likely to have major psychological issues, if I can say that. Because I know that out here in Licking County, the Humane Society here really concentrates on rescuing dogs from hoarding situations and puppy mills and stuff. So it's very rare to find a dog that comes out of the Licking County Humane Society that does not have issues. That's just the bottom line. So somebody calls and says, I have this dog and I got it from Licking County. Boy, I just have this. And usually I would say probably 8 out of 10 times I know exactly what this dog looks like and what the issues are. Not to say that we shouldn't rescue dogs from hoarding situations, but they're going to come with some real baggage that I think takes a lot to resolve. And I don't think most owners understand the degree to which they have to really work with this dog. And they really feel as though, but if I just love it enough, that should be fine. And, I don't think they also realize, like what Dr. Christensen said at NBC, that dogs deserve to have their suffering relieved through the proactive and rational use of medications. Yeah. And these dogs are suffering. And the only way we're going to get them well or have them, as you said, respond to a behavioral program is to lessen that overall anxiety so they have the ability to learn. Yeah. And,
the best analogy I heard on that years ago was that medication can open the window for learning, and then you can train new behaviors, and then hopefully you can start to taper off or make the medication go away. But the medication allows something to happen that was just not able to happen at that time. And I've talked to lots of my clients who I don't want to drug my dog. I don't want him to be an addict. I'm like, yeah, I hear you, but I think you should talk to your vet. I think we probably need to loop the vet in here and talk about this, because the progress that we're making without a little bit of help, we're not getting that window open. We're like, the window's still locked. Yeah. It's a problem.
And I don't think they realize that so many of these medications really are very safe for long-term use. My little Zuzu is on Prozac, and actually it's really helpful for me to have a dog that's on a medication, because I can say to people, look, my dog is on a medication, has been for a year, and really it's made all the difference in her world. Yeah. So I think that people forget that oftentimes we're prescribing stuff that's really pretty safe.
Yeah. And our goal is not, I never want your dog to be, our goal is not to be drugged. Now, sometimes with the short-term medication, if they're a little sedative and they sleep until we can start getting some things going, that's a short-term thing. But that's not our goal. Our goal is to have, for example, this dog wasn't playing with toys. Now the dog is playing with toys. They're starting to see, they're like, well, this dog doesn't like to eat. Well, probably because he's all worried about the whole world that he was in. Mm-hmm. Now they're like, oh, we better be careful. He's going to get fat. I'm like, yes, you're right. Great. Let's use Cheerios. We can change things around. But I would rather have a fat, happy dog than a stressed, terrified dog. I mean, there's ways we can fix that, that problem. Right. By changing things once we start getting the dog more comfortable. And I think it's harder in situations where, sometimes people don't want to use medication, and I respect that. and I'll do my best with whatever they have, with supplements. But like in situations where that dog, they showed a video, like they didn't even leave the room. And this little Pekingese was screaming. He was screaming. And she was like, what is that? And nothing, but owners don't recognize sometimes. That's why I love video and body language. She was like, what is that noise? And I'm like, well, that is complete. She was asking. I'm like, that's screaming, that's distress. And her face was like, oh my God. Like they just had no idea what they were seeing. They knew that something was wrong, but they didn't realize, well, he's new to the home. He's doesn't like being in the crate, but not realizing like that's a panic attack.
Yeah.
That little dog thinks he's going to die. Like it really does in that second.
Yes.
So,
well, I think that, and I think both Colleen and I do this, and I'm sure you do too, is when I'm working with a new client, in one of the first couple of sessions, I insist we go over stress signals so that they become increasingly aware of what's going on. And there's a great one, we've talked about it before, that Lily Chin does, which is fear in dogs. And at the top, there's a picture of a couple of legs that look like a monster, and the dog is cowering. And I tell people, I said, that looks like a monster, but that in reality is a person.
Yeah.
But your dog sees it as a monster. And if, I tell him, I said, if Sasquatch were coming down the street at me, I'm not going to run up, shake his hand, and invite him in for a beer. And if your dog views people as Sasquatch, then you can just see the light go off in their head. It's like, oh, I get it. So I kind of have to protect them. That's it. Exactly.
Right.
And so I think a lot of it's just education, just not aware of what is actually going on with their dogs. And when they are, then they're usually eager to do something to really remedy the situation.
Yeah. And I find it most of the time, not all, but most of the time with the aggression cases, there's a lot of miscommunication going on, obviously. And unfortunately, when some of the other in our area, they come in, they don't talk about those things, and they think, well, if I use this aversive collar, the shock collar, the dog stops what it's doing, but they don't see all the stress signals because they just see the behavior stop. So it's helpful. That's exactly part of what I do is I show them pictures. I've got some links to videos. I like the family dogs, keep your dog happy body language video, Zoom room body language that I ask clients to look at even before I come out sometimes so that they start seeing some of these signals. Because it's still hard, even when we talk about it, it's still hard. Like even this little dog that has separation anxiety, this little Pekingese, he did bite the owner a couple times however, this dog screams with its body language. I said screaming, but like with its body language, that it's not cool with the guy reaching over his head. I'm like, this dog is giving you so many signals that he's waiting for you to not do that anymore. So, it was even hard, even when I was there, I have to say, okay, instead of reaching over, let him come to you. He went under the table. He's done right now. I think, and that helped, I was like, there's still risk. Any dog that is bitten, they're more likely to have bitten before. However, I can see Bob is trying very hard to tell you, please don't come at me that way.
Right.
And now, things are better. And when they have people come over, they have rules. And if those people can't follow rules, then they don't interact with the dog. That's just how it is.
Right. And I do think that sometimes owners they're not reading it. I think in one of our episodes, I talked about a client I had one time when I was doing pet sitting, and I went to meet her two small dogs. And one of them came over to say hi to me, but the other one was sort of backing away. And she goes, "Oh, don't be so silly." She swooped down, grabbed the dog, and plunked it in my lap. And the dog and I just sort of stared at one another like, and the dog's like, and I'm like, and finally I just kind of petted it just a little bit, and then it hopped down. But when I went to pet sit, would that dog come anywhere near me? No. In fact, it dove under the couch, and I had to actually lift the couch and move it to get the dog. And, I think she just thought, oh, you're being silly.
Yeah.
No. And maybe I am. But the fact is, in this silliness, I'm afraid. And now you have really, so anyway, the dog never did learn to like me, but no matter how much chicken I used, but if you have a dog that is really that sensitive and their first encounter with this person is that stressful, that's really hard to overcome.
Yeah.
And I think that that's another thing that owners don't understand is that dogs can have these single event learning episodes that can really change the way in which they view not even that particular incident or that particular person, but the way in which they view similar incidences, because it can be traumatic. And we've talked to Dr. Patricia McConnell about trauma and the residual results of something like that. So I think education is such an important part of everything that we do, not just to remedy the situation or to train, but to educate so that behavior can continue to progress in a positive way.
Right, because people have the best of intentions. They just don't they don't know. And
to be honest with you, hey, of course it was 1997, which is a while ago, but I got none of that in veterinary school. So I can empathize with people. You know, I graduated from vet school and didn't know this stuff. And I went to one lecture by Tracy Schreier on body language, and I'm like, oh, how did I not know that? And like, once you start seeing it, it's like, it just opens up so many things. And but until someone shows or tells you, there's no way you're going to know.
Right.
So, Absolutely. And you're not going to know to look, right? You don't know what you don't know. So who's to know? Well, somebody may look up, why does my dog do that? That's not necessarily the same as exploring body language and figuring out why my dog, looks that way. Or people go, God, that's an odd thing to do. They don't think maybe that's a signal that they're telling me something. And what I also tell them is when I'm working with clients, I say to them, when you look at your dog and go, wow, that's kind of odd, that should be a little light bulb going off in your head that might be one of the dog's stress signals.
Right.
Because that's behavior that's out of the ordinary.
What made you decide to switch your practice to exclusively behavior work?
Well, some of it was personal, as far as it's just I could do doing things on my own, have more time with my family and balance it. But when I was doing, just like I was saying, when I was doing regular or traditional veterinary medicine, after having that lecture with Tracy Schreier, I started going, whoa, I've been doing this all wrong. I've been approaching my patients all wrong. I've been I just started trying to incorporate what I could. Now I've learned even more. I mean, I dove myself into the education, but starting, using the peanut butter and doing the things during exams and the treats and those kinds of things. And also there was an appointment that it was so sad and traumatic. My boss had to euthanize a dog, a lab. The whole family was in there. It had bitten a child. And to just see, and now the staff, it affected everyone. The staff was angry at my boss because he did euthanize the dog. But I empathized with the family. But I watched him do that, and I empathized with the family. I empathized with everyone in that situation. And I didn't judge it, but I could see, it's just totally traumatic.
Right.
And thinking and seeing, when I started in vet school, it was more about separation anxiety is the kinds of things that we were treating. But then learning more and more about the behavior and the fear and generalized anxiety, I wanted to help. I want to help. That's why the name of, I have the tagline, Protect the Bond. I want to help people have those positive relationships with their pets as much as possible. But unfortunately, for some reason lately, I'm getting animals so late, and I don't know why that is. Meaning they're coming to me when the problem is already so severe that the family is pretty much done. There's not much, it's just hard. It's hard. They want the quick fix, which there isn't any, or they want me to tell them, well, you push this button and it'll all be fine. And that's not what it's going to be. So I think, that's why I started, I wanted to focus most on behavior just because it's fascinating to me. And I also really like working with people too. Not that I didn't get to work with them before, but I just really I don't know. It's just something that I'm just very passionate about. Bite prevention, like trying to educate. And I think the other thing is because I was a veterinarian that had none of this, and see how dramatically important it is. It's also kind of a passion of mine to tell other veterinarians about the importance of it, and being involved with helping an Ohio State volunteer we have low stress handling. The freshmen go through, and I volunteered at the handling labs, helping teach the students, because I just think it's so important. And I even tell them, I'm like, you are so lucky to have this. Not every vet school has this across the country, and I've even had patients where what we do matters when we're in the exam room. And just like you talked about that one event learning, if you take 3 or 4 people to hold down a dog for that nail trim, that's going to affect how he reacts to his family at home. That could potentially, for grooming. Yeah. The next time he comes back, you probably aren't going to be able to touch him, because he might let you get away with that once. Or if he's on the flip side and he's a dog that's just so fearful, well, okay, maybe he lays there, but the stress and the terror that's going through his mind, how can you do that? Like, once you know, I get when you don't know what you don't know, but once you know, that's why I think it's extremely important for veterinarians to, have behavior, because even if you're not going to do what I do and go to the home and do, or have really long consults, you can at least make the exams and be questioning people so they don't end up with the wrong type of trainer. If they're having trouble, that you can get them to the right trainer. Or if you if you think it's more and needs medication and you don't do that, they can talk to Board of Veterinary Behaviorists or look for an AVSAV member in your area to work with. But that's kind of why I like this so much. And when I was
very passionate about it.
Yes, I am.
That's good.
And when that's I was little, ever since I was little, I was like, I always want to be a dolphin trainer. So it's kind of a cool thing, because it's I was interested in it when I look back. Sorry.
Well, that's great. That's great. And I think you're right. I think that many vets think that something that they'd like to do more of, but they're so busy doing vaccinations and taking care of other things that it's hard for them to know how to incorporate it and to understand that you can do fear-free handling. That's all part of behavior. And the fact that you're out there educating them about that is really terrific. I would like to see actually a fear-free handling for groomers, because I see a lot of people always.
Well, that's just like my little dog I've got right now. I know this dog has issues. It's a Pekingese. It's going to need care. And I'm wondering, oh geez, now if I do all this hard work helping him get comfortable, he needs a groomer to go to that is aware of this stuff.
Yeah.
So I try to educate clients, and I try to write up at least little handling plans so that they could take it with them.
That's a nice feature. Doing that so that they have some words to use with the professional that they're taking their dog to.
That doesn't mean they're going to do it.
No, but it at least helps.
I at least
yes.
Yeah.
I love that.
Well, we should put a link, Colleen, to Fear Free.
Yeah.
On the website. Yeah. And we'll certainly put a link to you, Laurie, as well.
Protect the bond.
Protect the bond. And Colleen, do you have any other questions for Laurie? I kind of feel like we could go on for a really long time talking with Laurie.
We always can. But no, I think we probably wrapped it up here at a pretty good spot for our family dog owners.
Okay.
Not everyone is as nerdy as we are and wants to talk forever about behavior.
But thank you very much for joining us. And I might be contacting you myself about my little Zuzu. So for me about that. I guess my other question is that do you ever have a place where people can bring their dogs to you, or is it always a consult in their home?
Well, for now, it's always a consult in their home. There may be some time in the future where I will have a situation where they can bring. But right now, I go to their home.
Okay, terrific. Well, thank you very much, and we'll see you all next time. Thank you.
Thanks for listening to Your Family Dog. Got questions? Interesting ideas? Colleen and Julie would love to hear them. Call 614-349-1661 or visit www.yourfamilydogpodcast.com to share your thoughts.